Namaskaram to all. I explained the meaning of this divine word. Let us all love each other so that the feeling for the humanity prevails in this world, which is sadly missing. Okay. Now, Candida is a very a topic that is very close to my heart like hypothyroidism. I learned about thyroid hormones and how to correct hypothyroidism the very hard way. I could sleep in the afternoon with the blanket on and with no fan and aircon. That's how hypothyroid I was. And this was about 20 years ago. And so similarly, this happened about 28 years ago. I had always had sinusitis. I had lots of allergic problems. Then about 28 years ago, allergies were quite bad and I had lots of bronchitis and asthma. And I started coughing out blackish sputum. My mucus, when I cough, was blackish. Now, when I sent it for analysis, it came back as fungus, black fungus called aspergillosis, which is common. It's common in the atmosphere. Only somebody with gross immune deficiency will suffer the infection. Otherwise, it's a cohabitant. Then I saw a pulmonary specialist. I had already taken tons of antibiotics over many years. I was given more antibiotics and also steroids. I could sit the whole night wheezing and coughing, and even nebulizers and not nebulizers, inhalers won't work, no medicine, including Western medicine, Chinese medicine, antibiotics, inhalers, nothing worked, all the powerful drugs. So this was going on, and then when I realized that the drug treatment is only making me worse, then I started reading about fungus. And that time there was not much of materials available. And there was no, I wasn't very sure about where to start. Then I came across a book. If you all want to read about it, it's William Truss. And I had to experiment a lot on myself. But it took me many years, more than 10 years to recover from the fungus. The reason is because I refused to take any more toxic drugs to treat the fungus. So I had to have a very holistic approach towards this menace that was in every part of my body, not only in the gut. Then along the line, I realized from treating patients as well that it is not just in the gut. So this is very unique how it presents, and we'll discuss most organs in which it invades and presents, but most of it will be in the gut. Okay, so let's start by looking and respecting our gut. We all eat, but digesting is the divine ability. You must digest what you eat, and you must digest it properly. Undigested food will become fermented, and it will feed the fungus and the bad bacteria in the gut. It doesn't feed you. So it's impossible, almost impossible, to have health and well-being without having a healthy digestive system. So the belief was there, and people realized centuries ago that you need to start with the gut. You need to have a good, healthy gut. So what changed this belief for us and for doctors especially to deviate from this sanctitious truth that you still have to start from the gut, because we don't address gut at all. So, oh, sorry, I think there is a spelling mistake. It's theory. Sorry. Okay. Maybe I can, okay, I'll change it later. Now, I just want to go through a bit of history, just to give you an understanding how and why antibiotics and vaccines became the main line of treatment for infectious diseases. So Louis Pasteur, I'm sure all of you all would have heard about it, is, of course, he's a brilliant scientist, biochemist. He's the person behind who introduced pasteurization. That's why you have pasteurized milk, but don't think it's necessarily good for you. Okay, it removes a lot of necessary good things which are healthy for you, not from milk, from products that are not pasteurized. I never endorse milk products. But anyway, he is the man behind pasteurization. He also developed vaccines. But of course, at that time, he was worshipped for introducing this theory where microorganisms, which includes bacteria, at that time viruses were not known because they didn't have an electron microscope, and fungus were the cause of fermentation and most diseases. So please remember this along the discussion. So here it says that germs are causing diseases. Nothing to do with your body. It's all to do with germs that invade, multiply, and cause disease. Okay. Another germ theory by Robert H. Koch. He actually has postulated, so it's called Koch postulates. Microorganisms must be found in abundant quantities in the sick people, but not in healthy people. This is the definition of infection. And microorganisms must be isolated from the sick, and we should be able to culture them outside. And when you introduce into the healthy people, it should cause a disease. So this is how they defined infections. But it does not explain that there are many people who are carrying viruses and bacteria and fungus in the body. Not many, all of us. We all have the germs in our body, and for that matter, the DNA from the germs are more than our own DNA in our body. So we are not just humans, we are humans plus germs. And I don't have another word for this, but we are humans plus germs. So we are not just humans. So this theory does not address the fact that we live in harmony with viruses, bacteria, and fungus or fungi. But as long as your body is healthy, they just remain as harmless and they don't cause infections and disease. Then in 1928, another germ theory, I spelled it all wrong, sorry. Alexander Fleming, he discovered the penicillin, but there is also a story that it was his assistant who had done most of the work. Now, how did he discover penicillin, the famous antibiotic? And this started the antibiotic era. He realized that when he left culture plates on the outside, mold or fungus started growing. This is, even if you can leave a culture plate, which you can get from a lab, leave it in your house, I'm sure you'll see a lot of fungus growing on it after a few days. You don't have to have a culture plate. You can leave just simple, what we call as agar-agar. So, and around this mold or fungus, there was no evidence of any bacteria. That means the fungus was killing the bacteria. And he extracted the chemical compound and named it as penicillin. So this was the first antibiotic, and this was the beginning of antibiotic. At that time, of course, this was applauded, and everybody thought, even now, many of us doctors believe that antibiotics is, they are game changers, but sadly not. They are helpful in emergency situations, severe, serious infections. Then came a brilliant scientist. But sadly, if you realize, those who recognize these names, you will realize, you would have remembered Louis Pasteur from your med schools. You would have remembered Alexander Fleming, but very few of us know about Claude Bernard. Now, he made a very, very powerful statement, and he made a lot of enemies because of this theory. His theory was terrain. Now, in this context, the terrain is your body, is our body. This is known as the terrain theory. So, as I mentioned, we harbor microorganisms. However, disease is caused when the body suffers from deficiencies and toxins, which means microorganisms cause disease. And in this context, we talk about infections. Okay. Infection is caused by germs in a sick body. Please understand this. Because we live with them and in harmony. And that is a symbiotic relationship. So that's important to realize. So the terrain is everything. You can say germ is nothing. So unhealthy terrain is the ground for invasion, breeding, colonization, and pathogenesis. That means it's disease. So we should stop blaming the germs for all the infectious diseases we have. Like now we blame the coronavirus or COVID-19. We never talk about why people are getting sick. Of course, many of you will be wondering now in this instance, in COVID-19, even younger people are getting infections. And we start blaming the virus for mutating and variants, and it never ends. This game never ends. But let me tell you, it all depends on the immune system. So we'll go through the reasons why there is so much of fungus, which will also explain the other reasons why the immune system is weak, including the young people. So if you want to take care of yourself, your loved ones, and for us, our patients, then we should seriously think about the terrain, that's the body, and the immune system in infectious diseases. Otherwise, as I mentioned at the very beginning, that these epidemics and pandemics are not going to go away because we are becoming sicker. And so I don't think that the viruses are becoming stronger, just that we are becoming sicker, most cases. So a sick terrain is because of deficiencies in vitamins, minerals, essential fatty acids like omega-3 and amino acids. Now, it is difficult to find a diet that gives you a complete healthy diet that is full and rich of vitamins, minerals. And most of us are deficient in essential fatty acids, and we don't get all the amino acids, especially the essential amino acids. We eat unhealthy diet, the Western diet, refined diet, fast food, and sugar. Sugar is an immune killer. The sick body is also because of deficiencies in hormones, and the hormones that are important for immune system are especially the thyroid hormones and DHEA. If you have excess insulin, it also kills your immune system. If you have an acidic body, most of the food that we eat are acidic. Mostly it should be vegetables to keep your body alkaline. Toxins and heavy metals. Sadly, this is introduced from birth. The first jab that is given to a newborn, like hepatitis, already has either mercury or aluminum. And these are toxic. So from birth, we are already introducing toxins. And babies, when they are bottle fed, they already receive their toxins. So this is what is happening in the body. Stress, psychological and physical, poor inadequate quality of sleep, because if you don't sleep because you disrupt your circadian rhythm, or you are deficient in melatonin, which is very important for your immune system, then you will have a sick body. And lastly, but not least, the antibiotics. I mentioned antibiotics. They actually does a lot of harm in many instances. They are useful in severe acute infections, but not as a routine, not for mild cough and cold, not for viral infections, not as prophylaxis. Because antibiotics, you will see that antibiotics promote fungal growth. This is the reason why especially women will realize that after taking a course of antibiotics, they suffer from vaginal thrush or vaginal itchiness. That's called vaginal candidiasis. Contraceptive pills, they are synthetic hormones that promote fungal growth, and other synthetic steroids. And this explains one condition that we see now with COVID patients called the black fungus, because of synthetic steroids being used. Another reason why you have a sick body is that we have lost the ability to understand the purpose of our being here and how we control our mind. Most of us have lost the ability to control the mind. So the negative thoughts and a disturbed mind is ruling the body. So it can kill you faster than the germs. So when you look at the terrain, there are some interesting facts that you want to just consider. This is medical term. Pleomorphism and polymorphism is just many types. Just understand as many types. Now, pleomorphism is the occurrence of multiple structural forms during the life cycle of a pathogen organism. So in this instance, let me give you an example of a bacteria. We have bacteria that has formed as a shape of an oval or a long tubal form. But if you have a sick body, bacteria can change its structure. So an oval can become a tubular form can become an oval form. And so they have the ability to change. So but of course, our medical teaching is we classify the bacteria as Staphylococcus, Streptococcus, and we don't have any understanding if at all they will change. They are able to change if the terrain is sick. Whereas polymorphism is the ability to change into entirely different thing. Now, I used to mention this. If you consider why and how we get maggots in our body when we are dead. Maggots eat dead bodies. I mean, that's how they clear. They keep the environment in a way better. So if you have a street dog, of course, you can believe that, houseflies sit on it and they get their maggots. But what about us who die? We have no houseflies sitting on the dead body. You still get maggots. Have you ever wondered why? Where did the maggots come from? They live inside us, not as maggots, as other forms. And when you are dead, your body is sick. As the sickest form is death. Your body is acidic, there is no oxygen. So they just change. That is pleomorphism. Just consider this fact. Yeah? Then you'll understand where I'm coming from. So Candida, surprisingly or not surprisingly, has this ability to switch itself. So this is one reason why it's not recognized. The second reason is if you want to pick up Candida, it is not from routine blood test or not from routine biopsies. Even if you have a tissue biopsy, like for example, a cancer, if we excise and we send it for testing, we only mention about what type of cancer or how the grade of the cancer. But fungus often coexists with cancer. So some people believe, they rightfully believe that cancer is a form of fungus. But the if you want to recognize the fungus, that is a special study. That's a special kind of histopathology. So it's very often missed because it can become a totally different thing, just like the maggot story that I mentioned to you. So they can play a huge role in invading your body tissues, and they can change their form to evade your immune system. Why is this important? Is because treating cancer is just not a one-shot treatment that lasts for a few days. It could be a very prolonged treatment. It took me many years, maybe more than 10 years, to get rid of almost everything. So that's why I call it a master masquerader. So I have presented this topic under different headings. I have done this under Catch Me If You Can or Master Masqueraders, because you can choose many names for Candida because it presents as different types. Now, this brilliant doctor, Orion Truss, now what he said is what we should believe as doctors. Every part of your body is connected to every other part. But unfortunately, subspecialization has isolated this. So we only concentrate on the heart or the kidneys or the lungs or the bones, and we do not treat the entire body as one system. So this one system approach is the holistic way, and this is how actually we should treat. So to speak of a disease of an individual organ is to suggest that autonomy that is undeserved. So it's not, you cannot have autonomy. Heart cannot function by itself. Kidney cannot function by itself. They all are connected. If one organ malfunctions, it is likely that there will be repercussions in most other organs. So if you want to treat a heart block, for example, unless it's acute, causing a myocardial infarction, if you really want to treat, you should look at the underlying cause. Like I've always mentioned, there's always one or more root causes. So just to differentiate between yeast and mold, there are many types of yeast. Fungus is just one. Yeast is unicellular, is a budding fungus, is common, it can be found on fruit stomachs, intestines, skin, etc., and in mammals. It can be aerobic and anaerobic and can cause infections. So what we are talking on today, Candida, is a yeast. Whereas mold is multicellular, is non-budding, but it has got spores. So it spreads wide and far. So this is why if you have mold in one part of your house, then people can get sick from being just in that house, not necessarily in that particular room. And because spores spread via air, they spread. Molds can cause allergies and respiratory problems. Yes. And that they typically grow in the dark and moist areas. So anyone who is suffering from fungal infection is more prone to suffer from the allergies of mold. There are about 6 million discovered species of fungus. About 300 can cause human disease. They are responsible for about 300 million cases and 1.6 million deaths per year. But we are not talking about fungus, because treating fungus is only with a few drugs, whereas treating bacteria with antibiotics brings in billions. Every human on the planet inhales about 1,000 molecules of it every single day. As I mentioned, they are everywhere. So we should stop blaming the pathogens. It's the terrain that is important. So Candida is a type of yeast. It generally can coexist with the host harmlessly, multiplies, invades, and causes variety of problems in immunocompromised individuals. So if your immune system is weak, now this is very important to understand. So Aspergillus I mentioned my experience with it. This is a black fungus. It lives everywhere. Fungus grows well when the immune system is, it ravages it. This is the black fungus that ravaged the hospitalized corona patients, at least 9 countries, resulting in up to 2/3 of those patients dying from fungal infections. This is black fungus. Of course, I've seen many more gruesome pictures. I didn't want to put them up here because it could be very disturbing. Anyway, it's called mucormycosis because muco is mucosal membranes usually, and mycosis is fungal infection. Now, you don't necessarily have to suffer from this. You don't necessarily have to suffer from COVID, for that matter, even Candida, if your immune system is strong. So let me give you a clue. Okay, we have about 70, I think about 70 slides that I'll finish as part 1, and then we'll continue from there, part 2 in 2 weeks' time. The date will be given to you at the end of the webinar. So remember this very carefully. If you have chemical intolerance or if you suffer from food allergies, you could be having Candida. Candida aggravates food allergies. It can initiate food allergies. It can cause multiple food allergies. And the interesting thing that I realized from my own experience is that Candida is capable of fleeting food allergies. That means changing food allergies. You are allergic to it today, you are not allergic to it tomorrow. So this is a reason why I often don't do many allergic tests, which are costly anyway. And the same thing with chemical intolerance. Sugar cravings is typical because, like cancer, Candida or fungus feeds on sugar. So you have more liking for carbohydrate foods and sugar. When you're high cortisol deficient, you also have the same issue. You can have headaches, you can have confusions. I'll go through, not today, tomorrow, in the next lecture, to tell you why people get headaches and confusion and irritability. So if you have these symptoms, then you probably have an overgrowth of Candida. Why I say overgrowth? I say they are harmless as long as they have not grown to a proportion where, or sizable proportion where they give you a disease, or if your system is compromised. And if you suffer from fatigue, a lot of toxins from fungus can cause fatigue. If you have muscle or joint pains, if you have depression, which is quite common in Candida, or if you have menstrual libido problems or partial loss of short-term memory and concentration, you could also probably have Candida overgrowth. Now, these are not directly from Candida. They are from the toxins released by the Candida. Candida can release hundreds of types of toxins, So they can have a multitude of presentations. Okay. Now, if the previous 2 slides that I mentioned, all the problems, okay, let me go through. If you have chemical intolerance, if you have food allergies, if you have sugar cravings, headaches, confusion, irritability, and if you have, fatigue, muscle and joint pains, depression, menstrual problems, memory problems, and concentration problems, and if they are associated with sinusitis or ear infections, pharyngitis and tonsillitis, please pay attention to children who are having pharyngitis and tonsillitis. If you have GERD, which is a medical term for reflux, or gastritis and bloating. Now, very, very often, 99% of the times, these GERD, gastritis and bloating are blamed on high stomach acidity or the presence of H. pylori. H. pylori is just an innocent bystander. That doesn't cause gastritis. And to get excessive stomach acid, is a very, very rare medical condition called Zollinger-Ellison syndrome. Zollinger-Ellison syndrome, which is very rare, where you get small tumors in the stomach, on the stomach wall, that secrete gastric acid. And it is very, very rare. So everything that we are treating as gastritis due to excessive stomach acid is absolutely wrong. It is everything to do with low stomach acid. I bet you, I can take a challenge that if you give hydrochloric acid to these patients, they'll only feel better because they digest the food better. So in all these conditions, there is low stomach acidity, and because it is caused by Candida, and H. pylori can only live in low acidity. If there is high acidity, it doesn't live. And if you have flatulence, a lot of gas, if anybody is suffering from irritable bowel syndrome or irritable bowel disease, Crohn's disease, ulcerative colitis, or diverticulitis, you are very likely to have fungal overgrowth, Candida overgrowth. So if you have sinusitis, pharyngitis, tonsillitis, especially if you have gastritis, bloating, and reflux, or a lot of gas, and if you have these problems in the colon or vaginal candidiasis, you have an overgrowth of Candida in the gut. So when you have a lot of Candida in the gut, it will invade the vagina. So very often vaginal candidiasis is treated with just suppositories. This is the reason why it keeps coming back. And it keeps coming back with a vengeance if it is treated with antibiotics as well. And if you are sick and tired of being sick and tired, so you are sick all the time, you have headaches, you have unexplained reasons for feeling tired, you cannot focus, you have brain fog, and you have very frequent, you wake up with sinusitis or rhinitis, and you don't know why you're sick. Most tests come back as normal. Then you should consider the master masquerader. And it will just challenge you, catch me if you can. So in these situations, you must consider Candida overgrowth very, very, very seriously. Okay. So candidiasis, millions infected, and it can double in quantity every 30 minutes because it just keeps growing. It's sadly, this is highly under-recognized, grossly misunderstood. Like, for example, I told you gastritis, it is underdiagnosed, and hence it is very much undertreated or almost not treated. You need to understand this if you want to treat. If you want to consider, you need to consider Candida for doctors. You need to consider candidiasis first if you want to treat. Candida has got many connections. Now, Candida antigen-related allergic symptoms can precede any local symptoms. Okay, what does this mean? So, Candida is very unique in the sense that you can have Candida in the gut, your stomach and your small intestine and your colon, and you can have only gut-related problems like gastritis, bloating, reflux, flatulence. Or if you can have Candida in the gut with gut symptoms, as well as symptoms outside the gut like vaginal candidiasis, you can have allergic symptoms due to Candida toxins like eczema. You can have autoimmune diseases like rheumatoid arthritis. The third presentation is you can have Candida in the gut, but asymptomatic in the gut. All symptoms are outside the gut. So why is this important to understand is because if you have all the symptoms that I mentioned, the likely, probably, and very, very likely, if you don't have symptoms in the gut like bloating, gastritis, or reflux, it doesn't mean that you don't have Candida. If you have all the other symptoms, you still have to consider And I can give you some clues how to pick this up. Okay, so this the allergic reaction or the toxins from Candida that causes problems outside the gut can present years before you have gut problems. So Candida has more than 100 antigens or probably much more. It can act as an allergen. So it can cause, because of overgrowth, it can cause problems in the gut, and the toxins can cause allergic problems outside the gut. Can cause or aggravate multiple food allergies, as I mentioned, chemical sensitivity. It can certainly cause autoimmune diseases, and it can suppress your immune system. It happens in someone who's already immunocompromised, and the Candida infection will only make it worse. It can cause metabolic abnormalities like diabetes, and it can cause hormonal disruptions, endocrinopathies. We'll go through most of it. One pathogen, but a variety of presentations, a myriad of reasons that fungus is much more frightening now than it has ever been. Because let me give you one example. Why do you think the children are so often sick nowadays? I mentioned to you one reason as hypothyroidism. Now, if these children are sick with tonsillitis, or they get bronchitis or rhinitis or flu-like symptoms, and they are given antibiotics again and again and again and again, and they keep getting sick again and again and again, one of the main reasons is Candida overgrowth, especially because of the use of antibiotics. And sadly, babies born by cesarean section already have a high risk. The reason is because the use of prophylactic antibiotics during cesarean section and oral antibiotics for 5 days after. So do you actually think that we control infections by using antibiotics as a preventive measure? I don't think so. For more than 20 years, I stopped using antibiotics as a prophylaxis. That means we give an intravenous antibiotic during cesarean section. And sadly, sometimes even before the baby is taken up. So the baby already gets a dose. And then oral antibiotics continue for 5 days after the cesarean section to reduce the risk of the so-called wound infection. More than 20 years, I've never touched antibiotics, not as a prophylaxis, not after the operation. Now, I hardly have seen an infected cesarean wound. Maybe because most of my patients take some vitamin C at least. But that is not the reason to use. But using antibiotics for during cesarean section increases the risk of the child newborn being sick because of increased risk of Candida. So why fungus or Candida is? In fact, Candida, as I need to inform you that it's just one type of fungus. There are many other types of fungus. And the type of Candida that usually we see in humans is Candida albicans, but there are other varieties. So why is becoming an epidemic? And I won't be surprised if this epidemics gets much worse. The reason is broad spectrum antibiotics. So antibiotics, when it was discovered, the first antibiotic penicillin, it was lauded as a significant contribution to human health at that point in time. But then now we realize that it has been mostly misused. Oral contraceptive pills, which most women take, they increase the risk of candidiasis. Synthetic steroids. When we doctors who are trained in bioidentical hormone therapy, we give hydrocortisone. We are always hammered by our colleagues because they say these are steroids and there is no proof and blah, blah, blah. But the steroids that are prescribed by conventional medical treatment is prednisolone. And now with COVID, it's a much stronger steroid called dexamethasone. So synthetic steroids, they cause a lot of side effects, and one of that is fungal overgrowth. Other reasons will be poor diet, especially refined carbs. Why carbs? Carbs. Why carbs? Because it becomes sugar, and sugar feeds fungus. It's very important to remember about carbs and carbohydrate-free diet during a fungal treatment. Sugar is another big problem, artificial sweeteners. Stress suppresses the immune system. Immunosuppressants, chemotherapeutic agents suppress immune system. And unfortunately, drugs like methotrexate that is often used in autoimmune diseases like rheumatoid arthritis suppress immune system. I can share with you one of my patient experience was, she was on methotrexate and some steroids and painkillers for rheumatoid arthritis for 15 years, and she was still getting swelling of the wrist and finger joints, and she gets effusion, water collection in her knees. For 15 years, she was on those drugs, and she kept on taking a higher dose. For the last 7 years, she is totally free of her autoimmune rheumatoid arthritis. And she had received multiple courses of Candida treatment besides other treatments. Chemo drugs, pregnancy. Why pregnancy? Because we don't understand the reason why, but 30% of pregnant women will have suppressed immune system. We don't know why, 30%. And of course, if your immune system is weak. Now, antibiotics, why they cause havoc? They increase the fungal overgrowth, and this Candida, when it grows, it releases toxins. The toxins will suppress the immune system, and then you get infections with more bacteria, viral, and parasites as well. So the same thing is done by contraceptive pills and diet rich in carbs. Okay. Now, when you have a yeast overgrowth, you can have chemical sensitivities and allergies. You can become nutritionally deficient and hormonally deficient, even if you have enough hormones. The reason is because the toxins toxins from Candida can actually block your receptors. So they don't allow your hormones to work. I'll have some slides on that. Nutritionally deficient because your gut is sick, so you don't metabolize, you don't digest your food well, and you don't absorb the nutrients. Now, on my left, the diet rich in carbs and yeast. Why did I put yeast? Now, yeast is not a problem for healthy people. If you have a mold or Candida problem, you should stay away from yeast during the treatment. Yeast infection causes leaky gut syndrome, which is a big problem. What it means is it creates microscopic holes in the gut, and then your undigested proteins can get into the bloodstream. And when your immune system picks it up as foreign bodies, your immune system will attack. And once the attack is over, your tissues, any other organs in your body that resembles this foreign body or the undigested protein will be attacked by your immune system. And that is one of the major reasons for autoimmune diseases. So gut infection with fungus, leaky gut, undigested protein into your bloodstream, your body attacking your your immune system attacking your own body, causing autoimmune diseases. But of course, leaky gut can cause food allergies, and then it becomes a vicious cycle. Once you have food allergies, your immune system becomes weak. So you get more yeast infection. Once you have weak immune system, of course, there are many things that can go wrong in your body. Right from cancer to autoimmune diseases, to more infections, to more allergies and chemical sensitivities. So if you want to break the cycle, you cannot break the cycle with synthetic steroids. You cannot break the cycle with anything for your allergies like antihistamines. You cannot break the cycle for drugs for autoimmune diseases. You cannot break the cycle with antibiotics. you have to break the chain, and by understanding Candida. Antibiotics cause gut dysbiosis, lack of probiotics. Now, what other things that one other problem with antibiotic is when you have good bacteria in your gut, they produce a chemical called butyrate that keeps your intestine wall healthy. When the good bacteria is wiped out because of antibiotics, you have reduced butyrate. So one of the treatment for fungus is to use butyrate as enema. I don't do this treatment, but that's one of the treatment. Other reasons would be excessive use of fungicides that actually saps your immune system and also kills the beneficial bacteria in your gut, so the fungus overgrows. And unfortunately, it could be a bigger problem in warmer climates, warmer and humid climates that allow fungus to grow better. Mold is a problem in dark and moist areas. So let's look now at how it presents. Okay, now I went through right from the probable symptoms to most likely symptoms in the body, right from fatigue to headaches to confusion and loss of memory and all that, to sinusitis, tonsillitis, to reflux, to gastritis and bloating, Crohn's disease, ulcerative colitis, diverticulitis. So it can present in any organ. So we'll look at gut and non-gut presentations, okay? Anything outside the gut. So how Candida presents is, I mentioned there are three ways. One is it can present as superficial Candida syndrome. That means it can just be in the gut and it causes, as I mentioned, I'll repeat this again and again. You can get reflux, you can get gastritis, you can get bloating, you have lots of flatulence, okay, a lot of gas. This is superficial Candida syndrome. That's all it does, okay? But being there, it can be either giving you problem or it can be silent. But what it does is it releases a lot of toxins, and that toxin can go into the body and cause Candida toxin syndrome. And one of the typical presentation here is eczema and psoriasis, okay? Or it can invade your organs and cause systemic candidiasis. I mentioned to you about me having suffered from aspergillosis or the black fungus, and that was systemic invasion of my lung tissue. So these are the three ways it can present. So if someone has the gut problems, like I mentioned, reflux, gastritis, and so on, it can be the only problem. You still have to treat. It can be the problem in the gut, but it is silent. You don't have any problem, but the toxins can cause eczema. You still have to treat the Candida. I hope you all understand this, catch this point. Or it may not have toxic syndrome, it may not have superficial Candida syndrome, but Candida can invade tissues. And this unfortunately becomes a histopathological feature. So whenever I see a patient, the first thing I do is I would like to know, besides taking history, I want to know if they are hypothyroid. So I feel the hand, I look at signs and symptoms, I want to know if they are hypothyroid. The second thing is, irrespective of the presentation, almost always, there are questions I will ask the patients to find out if they have Candida. So as we go along, you'll know what are the things, questions to look for, what are the symptoms to look for, okay? So it's very important to understand this. Candida can present in the gut only, or it can be silent in the gut, but can have problems outside. How is the problem outside? We'll also go by different presentations. So this is again the superficial Candida syndrome I mentioned. So it can be on the skin, fungus growing on the skin, on the nails, on the mucosal membrane like the mouth, or it can be in the esophagus, stomach, intestines, or vagina. It can have systemic effects because of the allergy to the yeast or the toxins of the yeast, or it can invade the tissues. Now, in the mouth, it can present this way. You see the white coated tongue? Yeah, this is typical. So I always ask the patients to show me their tongue if I'm suspecting, and especially this is in the morning. Okay, this white coating of the tongue. So the upper part of the gut is the reflux, nausea, gastritis, bloating, or leaky gut syndrome, malabsorption. So you eat well, but you still are deficient. You have signs and symptoms of deficiency. Now, when the fungus invades your or present in the large intestine or the colon, it can cause bloating or flatulence. It can cause irritable bowel syndrome, ulcerative colitis. I am sure you know someone or yourself who has got some of these problems. Think about Candida. So if it is ulcerative colitis, unless you understand this, it is impossible to have a cure. You will not be able to cure yourself. But all these conditions are reversible. You can cure patients. It can be Crohn's disease, it can be diverticulitis, you can have constipation, or you can have diarrhea. And sometimes it presents, like for example, if someone has a lot of candida overgrowth in the gut, magnesium generally doesn't cause diarrhea unless it's excessive. These are patients, even if you give a standard dose of magnesium, they can have diarrhea. So these are unusual presentations. And one other symptom is itchiness around the anus. Okay, it could be worms, but it could also be fungus. So this is again other presentations. You can see ulcers. I am sure you would have come across children or adults who have multiple ulcers in the mouth, recurrent multiple ulcers called aphthous ulcers, usually because of gut dysbiosis or vitamin B deficiency. Generally, you have to also look at the immune system. In the lungs, it can, in the breathing passage, okay, respiratory symptoms system, it can present as tonsillitis. So children who have recurrent tonsillitis, please consider Candida instead of removing the Candida tonsils, which actually is a very important gatekeeper for our immune system. It can present as recurrent sore throat or bronchitis and asthma. All the patients, any one of my patients who present with asthma, I'll always treat them for Candida, irrespective of the gut symptoms. This is a presentation on the skin. Yeah. You can also have erythema, red patches on the skin. Eczema, this is before, and this is after. So you don't have to use steroid creams. You don't have to use antibiotics. You don't have to use synthetic steroids. You do not need anything for itchiness. You don't need antibiotics. It's just Candida and boosting immune system. Eczema, another typical presentation of Candida in the gut. This is a lady, 43 years, with signs and symptoms of eczema, but she also had gastritis and slow digestion. And when she had a gastroscope, the diagnosis was Helicobacter. Now, the problem with H. pylori is that the treatment, you can see the eczema on the foot. Oh, that's eczema. The H. pylori treatment, unfortunately, involves at least 2 to 3 weeks of antibiotics, which is going to worsen the Candida. It also involves drugs to suppress the acid in the stomach because it's misunderstood as hyperacidity and low acidity. When you reduce the acidity, candida is associated with low acidity, not hyperacidity. When you reduce it further, you disrupt your digestion. When the digestion is disrupted, you will have problems with food digestion. So if the food gets fermented, fermented food will become food for the fungus and bad bacteria, not for yourself. So the whole treatment of gastritis and H. pylori, in my opinion, is absolutely wrong. Wrong in the sense that you don't need antibiotics, you don't need anything to suppress the acidity, you don't need anything for reflux, you don't need all these drugs. You just need to advise them about slow eating, chewing the food well, treating the candida, and many of these patients would actually feel better with hydrochloric acid, not antacids or drugs to suppress the acid. Now, this is a gentleman who presented with psoriasis, and he had all the symptoms in the gut as well as arthritis. So when I treated this person for candida, because you see he has psoriasis, I will treat candida first. Gut problems, I'll also treat candida. Arthritis, I'll also treat candida. I'm not talking about osteoarthritis, this is rheumatoid arthritis. And within 10 days, this gentleman had improvement in rheumatoid arthritis. Psoriasis takes time. And gut problems also will go away very fast. This is another young gentleman, psoriasis, you can see. Yeah. Now, if you look at the results, the DHEA, which is important for immune system, is low. The T4 is on the low side because I did mention to you all that it shouldn't be at the reference, it should be at the upper limit here. The homocysteine is very important. It's a very inflammatory amino acid in the body, which suppresses the immune system. Should be less than 9, here it's 27. The CRP, which measures inflammation in the body and very useful to understand gut inflammation. It should be less than 1, it is 2.7. And of course, his vitamin D level was below the reference range. So it's important to treat the candida as well as to look at the hormones and vitamin D. Candida of the nails, you still have to treat the gut. This is why topical candida treatment does not help. It's not only treatment, you have to combine it with the gut. Now, this is one of my latest. He is a contractor, very nice gentleman. He had stenting done about 10 years ago. Okay, his problem was gouty arthritis, severe swelling. You can see swellings. So this gentleman had gouty arthritis, and he came to me with swellings on the feet, ankles, swelling in the wrist and the small joints, and very severe pain. He was limping. He had also had hypertension. He was on 2 drugs. He was on statins to lower the cholesterol. He was on a blood thinner, and he was on colchicine for uric acid and painkillers. But he still ended up suffering. So at that end, he had chronic renal failure. Okay. So this was the blood test. Urea was, urea was 18, very high. His creatinine was 227. The normal is 50 to 116. The eGFR, the glomerular filtration rate, which is a very good indicator of remaining kidney function, was only 27. Optimum should be more than 90. So this is a chronic renal failure. Uric acid was 6.2. CRP was 7.1. It should be less than 1. His cancer antigens were normal. Now look at the repeat. May and in June, urea came down. July came down to 9.6. Creatinine came down to 195. Now it stands at 177. The glomerular filtration rate, reflection of kidney function, has gone up to 32 and now is 36, which is good. If I can bring him to 50, I'll be very happy. Okay. But his uric acid for some reason went up and now is coming down, and his CRP has gone up. I can't explain. He has no gut problems. But of course, I treated he went on keto diet. He lost 8 kilos and I treated him for candida. So he has stopped all drugs, and from two antihypertensive drugs, now he takes half the tablet on alternate days, and the blood pressure is usually between 130/80 or 120/80 to 130/90 at half the tablet on alternate days from 2 tablets every day, and nothing for gouty arthritis, no painkillers, no cholesterol drugs, nothing. And he feels better and he looks wonderful. So can we help patients even with chronic renal failure before end-stage renal failure? Of course we can. Yeah. So I'll explain to you maybe in this lecture or the next one why patients get gouty arthritis or why they have high uric acid. So you don't have to treat the uric acid. You just have to understand the reason. Of course, there is vaginal candidiasis in women is very common because of antibiotics and high carb diet, including sugar and the use of contraceptive pills. Okay, now in women, it can present as infection of the uterus or uterine lining. It can present as infection of the fallopian tubes. Now, it is not a common condition, but we do see women who have, we call it tubo-ovarian abscess. That means infection of the tube and the ovaries, and it will be just a collection of pus when we open up. Almost always this condition is treated with antibiotics, but almost always the presence of antibiotics is not the main reason. The main reason is still fungus. So this, when they have infection of the fallopian tube, that infection can spread to the pelvis, and it is called pelvic inflammatory disease. And as I mentioned, abscess or pus formation in the tube and the ovaries. These are the presentations in the women. It can also, if you look at other organs, let's consider one factor of energy. Now, candida typically presents as lethargy, just like hypothyroidism. The reason is because not the candida itself, it is the candida toxins. For those of you who want to read up, please read about acetaldehyde, ACET, aldehyde, ALDEHYDE, acetaldehyde. Now, this will be discussed in part 2, but please read up. It will be quite heavy for the public. It's not the entire lecture. Part 2 is on acetaldehyde, a few slides. But if you can read something before you join the webinar, the next one, the part 2, it will be easier for you to understand. Now, this is one of the candida toxins among the many. So candida can also cause chronic fatigue syndrome. So we have looked at the gut, we have looked at the skin, we have looked at the nail, and we have looked at other skin conditions like eczema and psoriasis. We have seen a case how candida can actually cause gouty arthritis. Candida affecting the brain. It can present as depression and brain fog, loss of short-term memory, inability to concentrate, insomnia, or panic attacks. Some of these can be caused by lack of cortisol. Lack of hormone cortisol can also weaken the immune system and that can cause candida infection. So of course, there are many other reasons. There are other reasons for loss of short-term memory, but please consider candida. So why I'm saying this is, whenever somebody presents a depression, just don't reach out for antidepressants. Find out if they are hypothyroid. Find out if they are low in omega-3 fatty acids, if they are low in magnesium. Ask about the symptoms in the gut. Always ask the symptoms in the gut. Look for a white-coated tongue. Ask them if they have any skin allergies or food allergies. Those are the things that can give you a clue. One of the big problems of candida is that the toxins affect the liver. Liver, we know it does many functions in the body, including synthesis of important proteins. And one of the most important thing is that it actually helps in detoxifying your chemicals and toxins. But once the candida toxins affect the liver, it can cause swollen liver or hepatomegaly, and it can cause fatty liver. But the problem with fatty liver is more of high carbohydrate diet, which becomes triglycerides, and that triglycerides get deposited in the liver to cause fatty liver. But a high carbohydrate diet anyway promotes fungal overgrowth. And when the liver is affected, you have a decreased ability to make your own glutathione. That's why most of us are deficient in glutathione. And when the liver is affected, your ability to detoxify toxins and chemicals become less. So your ability to detoxify is weakened or poor. I mentioned to you that one of the reasons for candida overgrowth is presence of toxins and chemicals. Now, if the candida affects the liver, it just makes it worse. It becomes a vicious cycle. Increased conversion of chemicals and drugs to more toxic compounds. What it means is, we have phase 1 of detoxification in the liver. We have phase 2 and phase 3. Now, the first phase of liver detoxification where the toxin is converted to the less toxic form. That means they are converted into more water soluble. Then the second phase will convert it into something that your kidney can excrete. So if the presence of candida in the gut and the associated toxins released from the gut that affect the liver will slow down your phase 2 detoxification. So phase 1 generally proceeds as normal. So once the toxins are converted into another type, they must be quickly processed and eliminated from the body. If this phase 2 is slowed down, and if the phase 2 is running at a normal pace, then your body is going to be overloaded with these toxins just before they become water soluble and excreted. So in that sense, the toxins can be actually made more toxic. So they present a bigger problem. So identifying the presence of candida in someone who has raised liver enzymes or liver problems is important. Candida can also affect your muscles and skeletal system, causing pain in the muscle, myalgia, or joints. It can cause, as I mentioned, chemical sensitivities. It can cause food intolerance, food allergies. Food intolerance is not an immune, it's not related to your immune system. That's a difference. Food allergies, there is immune system involved. But I hardly ever do, unless requested by patients, I don't do allergy testing, because if you identify the cause, you can fix it. And one classical presentation of candida is that it can cause multiple food allergies. When I had these candida problems, you'll be surprised what I can eat. I can't even eat curry. I couldn't eat pepper. I couldn't eat even onions. And some days I couldn't eat garlic. And some days I couldn't eat curry. Some days I couldn't take coconut milk and coconut oil, and so it can be fleeting. It can be of multiple food allergies, and it's very, very difficult to have a diet that you can take because it keeps changing. And I tried to keep food diaries, and everything was becoming, it was so difficult until I understood Candida. So my experience with Candida is long, and my association with Candida is also very, very long. So this is a topic that I am very familiar with, and I would like to discuss. That's the reason why I thought I should bring it here and make sure that all of you all understand that it can present in so many ways. Allergies, it can be eczema, chronic urticaria, or the red swollen areas on the skin. It can be itchy. It can present as asthma. Almost always, if you ask asthmatic patients, they will have gut-associated problems like bloating, gastritis, or reflux, or they will have sinusitis. Or in the morning, they have runny nose. Now, including ENT journals, this is an accepted fact that 80% of sinus infection is caused by fungus, not by bacteria. And yet antibiotic remains the mainstay of treatment. For my sinusitis, I had taken tons of antibiotics and I had 7 surgeries and nothing helped. So it could be just fungus. Candida can cause migraine because of the toxins. As I mentioned, this is sugar craving is very typical of Candida. Someone who has Candida overgrowth, they like to eat carbohydrates. Another reason for sugar craving is cortisol deficiency. But of course, sugar is addictive. The more you take, the more your brain wants it. So, but keep in mind, cortisol deficiency and Candida are two of the big reasons for sugar cravings. Very important to recognize the next point, frequent urinary infections, especially in ladies who present with infections of the bladder, infections of the kidneys. They can have painful urination, they can have frequency, they can have urgency, or they can have blood in the urine. Almost always, they do very well when you treat them with fungus. And failing to recognize is the reason. If you ask women who have suffered from urinary infections, they will tell you that they are having repeated infections despite the most aggressive antibiotics. So if there is very good evidence to use antibiotics for urinary infections, my advice is use it together with the antifungal treatment, which we'll cover in the next lecture. Antibiotics promote fungal overgrowth. If you cannot avoid taking antibiotics for some serious infections, it is advisable to combine with the antifungal treatment, so to reduce the risk of fungal overgrowth. Candida can affect your hormones because this Candida, they have hormone receptors like us humans, especially for steroid hormones like the 17-beta estradiol, which is a female hormone, which men also have. So when you have Candida, the Candida or the Candida-related toxins can occupy your hormone receptors and prevent your endogenous or your natural hormones from doing its job. So it's a very important point to understand, because presence of Candida can cause hormonal disruptions in the body, both for men and women. So what it means is that there is end organ unresponsiveness. So blood results will show normal hormone levels, but the problems will be that associated with hormone deficiencies. So if it affects the ovaries, a woman can have menstrual problems and decreased libido or interest in sex. It can also present as dysfunctional uterine bleeding. That means bleeding in between menses. It can cause miscarriages or premature deliveries, just like hypothyroidism. So you can have menstrual cycle effects. It can affect pregnancy. Contraceptive pills. Now, some women do not tolerate contraceptive pills. I don't promote contraceptive pills. But when women want to take, there are women who can't take even a smaller dose. A woman can't tolerate contraceptive pills. Please keep in mind Candida or the fungal overgrowth, because it just makes it more potent. It can cause premenstrual syndrome, irregular cycles, painful menses, painful sex, frequent infections of the urinary tract. It can cause infertility. It can cause endometriosis, which is menstrual blood outside the uterus. It can cause depression, irritability. Now look at the next point, small breast. There are many young girls nowadays have small breast. Or women tend to have smaller breast now. The reason is because, one of the reasons is because if you have Candida, I told you that your end organ becomes unresponsive to hormones, because Candida will occupy the receptors and prevent your hormones from working, especially the estrogen. And estrogen is very important for breast development. And there could also be recurrent vaginal infection. So this is Candida and women. I put up a special slide just to address some special issues that women experience. Because you can have PMS, you can have irregular cycles, you can have urinary infections or vaginitis. Please consider Candida. Men, decreased libido, impotence, erectile dysfunction, and effects on the spermatozoa. So men have their own problems. Now in the part 2, we will see the connections between Candida and cancer, and we will look at some presentations in the newborns in children. And very important and very interesting is, how do we treat Candida? Okay. So we can take some questions. Yamuna.
So, should we take some questions or should we go for the testimonial?
Sorry?
Questions first or testimonial, Dato?
Okay.
Yeah.
I have
Cecilia.
A very nice friend who actually I requested her to share her experience of treating herself a chronic problem with Candida, and of course, you know, with immune boosters, and she is very disciplined with her diet and exercise. So, so Yamuna, can we have Cecilia?
Hi. Yeah, hi.
Hi, Cecilia.
Hi,
Dato. Good evening. Very good evening to
Can we
everyone
see you?
on board.
Yeah, can we see you? No?
not really prepared for it.
Oh, okay, okay.
Okay.
Okay, Cecilia. Yeah, yeah. Namaskaram, Cecilia.
Namaskaram, Dato.
Okay, let
Yeah,
us.
yeah. To share with all of you, actually, I would say it's like a miracle for me because I've been suffering for many, many years until I saw Dato on January this year. From then on, I have been on this candida treatment because I have this diverticulitis, right, doctor? Am I
Yes,
saying it right? Yeah.
diverticulitis. Yes.
Yeah. And I have lots of problem after eating. I have bloating and I have lots of discomfort and I start burping. So it was very miserable actually. And then I was very hefty in my weight. And I followed very strictly. The first time when I saw him, he actually thought that I wouldn't make it. But it was a challenge for me. He said he was very worried whether I could make it. No doubt it was very tough for the first 2 weeks because he said no, nothing on carbo, no sugar, no fruits. Oh, I was thinking, oh, what am I going to eat? But anyway, I survived until now. We don't eat rice and we are just totally on millets, both me and my husband. And I feel very good. Earlier, I can't bend down to reach my kitchen cabinet to take things, but now I can just squat so well. With all this treatment, I think I'm still on it now, 6 months on this treatment, and I feel very good. Really, thank you very much to doctor. I'm always Nyastatin is just beside my bed. Before I go to bed, I just put it, and then I wake up. The first thing is that it was like, I'm so stuck to it, and it's really, really gives me a lot of comfort. And I'm so comfortable now, feeling very comfortable, very agile. Earlier, I used to drag myself from 83.5. Now I've gone to 76 kilos. And I think that's a real great achievement for me because I've never been able to reduce weight. It's like, even with exercise, it's just like 2 kilos, 3 kilos, and then there again I go. But this time it was like, it just came down, came down, came down. It's still coming down because I kind of not really strictly keep to the earlier diet, but I make sure that we eat proper food, proper diet, like what Dato told us. So thank you very much. I think I very very grateful to Dato.
Thank you,
He was
Cecilia.
the only one who could. I've been seeing lots of doctors, specialists, but nobody could help me. He has really helped me a lot. Thank you so much, Dato.
Thank you.
Thank you.
Thank you. She's a very wonderful lady. I spoke to her today, and so she says she wakes up every day early, and she cooks 50 meal for 50 people every day to feed the poor and the needy. Every day for 50. Now,
Yeah, that's my passion.
bless you.
I mean, passion. I like to feed people.
God bless
So
you, Cecilia.
it's not tough for me. But with all this medication, I think I've become very agile. So thank you so much, doctor. Thank you. Good night.
Thank you. Thank you. Okay, okay, Cecilia. Okay.
Thank you, Cecilia. Okay. Datuk, shall we take questions?
Yes.
Okay. Datuk, from Miss Grace. Datuk, how do you do a test to find out infection caused by Candida? Is it just a blood test or through stool examination too? And can we find out the type of Candida through the test?
Okay. One, you have to increase your volume a bit, Yamuna. Okay. It's how to pick up Candida, right?
Yep.
Okay. I went through the slides to show how it presents as white coated tongue. It can present as frequent sore throat. It can present as frequent flu-like symptoms or tonsillitis. It can present as asthma. It can present as bronchitis. It can present as reflux, as gastritis, as bloating, as flatulence. It can present outside as eczema. It can give you autoimmune diseases. It can give you some of the very, very chronic conditions in the colon, like Cecilia mentioned diverticulitis. Diverticulitis, a medical term, actually it's a very serious condition because the colon just bulges and has lots of out pouches instead of a tube. It just has pouches, out pouches. So these out pouches, they actually food, undigested food or fecal matter can actually accumulate in the out pouches, and they cause recurrent infections and repeated antibiotics and presence of fungus and overgrowth of fungus. So that it's just relentless. So it can present in any one of these ways, including eczema or psoriasis or migraine. My point is, it presents in such a variety of way that I make it a point to ask patients if they have any gut problems, or I look for clues outside the gut. Now, the second thing is that if you do blood tests, especially CRP, if it is raised, unless it's when you check, there should be no infections or injuries because CRP will be raised. So that could be an indication. And then the next lecture, one, we will go through some of the investigations. You can check the stools, you can check the urine. So there are ways of testing for Candida. But I am a clinician. I would like to base my diagnosis mostly on my skills, which I shared with you, and some simple blood tests, because routine blood tests for stools and urine can be very expensive. Okay.
Okay. Dato, another question from her. Can Candida infection in your gut cause polyp, like colon polyps?
Can cause colon cancer.
Polyps.
I'll share, this is again the part 2, called Candida and cancer, but I can just give you some short answer now. Candida and cancers are closely associated. There are doctors who believe that all solid cancers are actually fungal infections, and they have had good success just by killing the fungus, and they have histological proof. And I can't remember often this Italian doctor who proved that Candida, solid cancer is Candida, with his histopathology and the treatment protocol. He was becoming so popular that he was delisted from the Canadian, Italian medical registry. He was just delisted. So yes, for telling the truth or saying something that is different from what you are told to believe. Yes. So we will look at the association between Candida and cancer. Why Candida can be a cancer, why cancer is associated with Candida. Because both feed on sugar, both live in an acidic body, both love hypoxic conditions, low blood oxygen. And both can only survive if your immune system is compromised.
Okay. Okay, Dato, next question from Dr. Sofian. As you mentioned that we can heal candidiasis by improving butyrate production in our body. If we use this option, does it mean that we have to increase the production of short chain fatty acids by eating a lot of food containing mostly high fiber? Which one is more beneficial, is soluble or non-soluble fiber?
Now, as far as fiber is concerned, it's always good to have a combination. But there is one problem with Candida, because it causes bloating. If you increase the fiber before you kill the fungus, you could worsen the bloating problem. Okay? Then if you can add on slowly, it's a combination of both soluble and insoluble is always better to increase the butyrate production. That's one way. Taking probiotics is another way. Probiotics again is controversial, whether you give it during the fungus treatment or give it after. I don't see any major difference if I give it during the fungal treatment. So these are ways. And of course, as I mentioned, some people do butyrate enema. You can buy butyrate and use it as an enema to increase the butyrate in the lower colon.
Dato, also from Dr. Sofyan, there's a thought that overgrowth of yeast such as Candida albicans in the case of candidiasis usually caused by the reduction of commensal bacteria.
Yamuna, sorry, it's breaking. I can't hear the question clearly. And
Oh,
you're
sorry,
not
Dato.
loud enough for me.
Can you hear now, Dato?
Now, okay, now better.
Now better?
Yeah.
There is a thought that overgrowth of yeast, such as Candida albicans, in the case of candidiasis, usually caused by the reduction of commensal bacteria population, such as Lactobacillus acidophilus and Bifidobacterium, that creates microbiome imbalance and even a less diversity. What's your take on this?
I can catch the first part. Whenever you have reduction, or if you do not have the beneficial bacteria, which keeps the fungus under control, you can have an overgrowth of candida. So that's why in candida treatment, part of the treatment is reforestation or recolonization of the gut with beneficial bacteria. You can't wipe out the candida 100%, but you can reduce the load and increase the beneficial bacterial load. Speak a bit louder, Yamuna.
So can you hear clearly now?
No.
Tapi,
There's a static sound, Yamuna.
tapi,
Yeah.
tapi
Okay,
can you
anyway,
read
in
out
the
the
meantime, I can ask,
Yeah.
I can answer this question. What is the relationship with redundant colon, twisted intestines, and candida? Now, redundant colon and candida, I mentioned to you that candida can cause constipation and sluggishness of the colon can also be because of hypothyroidism and low magnesium. So please consider this as reasons as well. The rest all is congratulations to Cecilia. And then, Dato, is it common that small intestine bacterial overgrowth, SIBO, happens together with fungus or yeast overgrowth at the same time? Now, my experience is it does. Now, I can tell you my personal experience is that because when I overcame the problem of fungus over many years, I used to have occasional problems. So I was advised, why don't I just take a small dose of antibiotics to clear this SIBO? Okay. Now it was just a small dose. That was enough to upset me all over again until I had a perforated appendix. So I realized that even SIBO, so as far as my clinical experience is concerned, over 2 decades. Now, whenever I see conditions like SIBO or gut dysbiosis, of course, I'll take very serious consideration of diet and immune system, but I treat just the fungus. And very often, almost always, I have very good success rates just by treating the fungus and recolonizing the colon with beneficial bacteria. Do you need to treat leaky gut along with candidiasis treatment? Yes, but the treatment is this. You need to kill the fungus, candida, because it causes leaky gut syndrome, and anything that worsens leaky gut syndrome, gluten, sugar, and dairy. How does candida influence men's health? Of course, candida can affect men's health because it can cause prostatitis, not directly, but the toxins and the 17-beta estradiol receptor block can also affect the functions of estradiol in men, causing some of the changes that I mentioned in libido and erection. how does Candida cause endometriosis? Now, I don't have a definite explanation for this, nor have I come across in any textbooks. But very often, if you see patients with endometriosis, when you ask them specific questions, that means eliciting a history about gut candida, you will get positive answers that the patient is suffering from bloating, gastritis, and reflux or flatulence. Now, this is an association that I'm able to make clinically. So not every candida endometriosis patient I treat give candida treatment, but if any one of the questions, the answer is yes, I would treat. If PCOS related to candida, is moving the peripheral, okay. Now, polycystic ovarian syndrome is caused by high insulin levels. I've mentioned this before. And then high insulin levels again is caused by high carbohydrate diet and high blood sugar. And there you go. There is no reason why it shouldn't be associated with candida. Taking yogurt reduces candida overgrowth. Yes, if you take organic yogurt, especially if it is organically farmed milk portion. You can take even fermented foods, but yogurt and fermented foods are not recommended during fungal treatment. During fungal treatment, do not take. And after that, you can try. If it causes any disturbance, then you do not. Frequent urination in women due to candida treatment. Why and how to treat it? The treatment, Jason, we can look at it the next lecture. But frequency, painful urination, even blood in the urine is often because of candida or coexisting bacteria and candida infection. That's the reason why I mentioned, if at all is necessary to use antibiotics, which I don't, then it's better to combine with candida treatment. Can you share the treatment? Now, please be ready with a notebook when I talk about this in the next lecture. H. pylori gets eradicated better with more potent PPI in XCM, amoxicillin, erythrocin, the control of. Now, the question is from Co. Notice that H. pylori gets eradicated better with more potent PPI. I suppose it's due to lower acidity that makes H. pylori fragile to treatment, conventional belief. Now, as I mentioned, H. pylori actually thrives in low acidity. I have not seen a patient who has not responded, a patient with gastritis or reflux who has not responded to candida treatment. I have not seen. Now, most patients, of course, they come with the OGDS, the scope results, which shows inflammation, which is presumed to be because of high acidity, but it's almost always because of candida. Proton pump inhibitors induce candidiasis. Yes, because they suppress acidity. If you reduce the stomach acid, how is your food going to be digested? If the food is not digested, then of course it can lead to candida, because the fermented food will promote candida as well as gut dysbiosis. Supplements, we will look at it as treatment. Next lecture, Amelia, for treatment candidiasis, mix together with another antibacterial like. Well, the question is whether we should mix antibiotics with candida treatment. I mentioned to you just now, this is not my way of treatment. If at all, there is a very good reason to use antibiotics, but please use with candida treatment. How do we manage infection? We will look at it the next lecture. Apple cider vinegar has any role? Apple cider vinegar is generally is good for health. It's also alkalizing for the body, but it is a fermented product. my recommendation is do not take it during fungal treatment or do not take it during the first 2 to 4 weeks of the treatment. Can ivermectin kill H. pylori? I am not sure. Lab found enterococcal fecalis in urine culture, repeated urinary tract infection. How can I treat the first action? Now, I mentioned, this is from Dr. Indra, that especially repeated urinary tract infection, please consider candida, and then we'll go through how to treat, and you try, you'll be pleasantly surprised, irrespective of what the culture shows, because we are not culturing for fungus. If you want to look for fungus, the culture should be at least for 2 weeks. You must make a special request to the lab that you want them to look for candida fungal yeast growth for at least 2 weeks, the culture medium. Honey helps in candida infection. Honey is as sugar, it's beneficial. So you should be careful during candida treatment. Otherwise, a small dose is okay. For treatment, candida treatment, is it necessary to mix another? Okay, that one we have gone. We are treating candida. Should we give vitamin D and glutathione, which treat? Now, vitamin D and glutathione, they do not treat candida directly. We will discuss this in the next lecture. This is the rule. For some of you want to read about it. How do you treat candida? How do you manage candida infection? You have all the signs and symptoms. Mostly they are sufficient. If you want to look for some lab evidence, CRP will be good. You can look for insulin. I routinely do insulin and homocysteine as well. The other investigations I'll go through the next lecture. So these are the rules of candida treatment. Number one, we will look at how to starve the fungus. Very important. You cannot kill the yeast and beat the yeast, because yeast is not like virus or bacteria and you spot on, you kill, that's it. Yeast is rooted. It has roots. It will have buried into your intestinal walls, and it can grow by forming hyphae. That means it has branches. Imagine like a tree. So you chop one side, it will grow. You chop this side, it will grow. It will keep growing again and again and again. So you have to starve the fungus. So we will look at the diet. Number two, you will have to kill the fungus. You look at the treatment. Number three, you have to boost the immune system. We will look at also the treatment. Number four, you have to improve the detoxifying capacity of your body, because when you kill the fungus, there's going to be a lot of toxins released, and your body should be able to cope with the toxins by having good detoxifications. Number four, you should alkalize your body, because acidic body will promote the fungal growth, and alkaline body will also help to detoxify the toxins. So these are all the main pillars of fungal treatment. Okay. So I will remind you again in the next 2 weeks. Please do share nutritional support dietary plan. Yes, coming Dr. Rabia, 2 weeks time. We will discuss, because it's the most important thing is for you all to understand how candida should be treated, because it is not a 5-day treatment or 3-day treatment. No, sometimes it's for months. Any other questions, Yamuna?
No, that.
Another lecture that I enjoy, but of course it may be a difficult thing for non-doctors, is mitochondrial health. Our mitochondria is so important that having a healthy and functioning mitochondria is critical for health and longevity. We are understanding how mitochondria is related to almost everything that happens in our body, including how it's connected to cancer, mitochondrial dysfunction. This is new. A lot of this is new knowledge to us. But keeping mitochondria healthy was recognized 5,000 years ago, simply by understanding how you control your breath, your breathing, to have better mitochondrial function. So in yoga, I'm sure the same is in Tai Chi and Qigong. There's a way of yoga breathing. There are many types of yogic breathing. One is where you control your breath very slowly. That means you break up your your breath cycles into breathing in or inhalation, then you hold. Breathing out is exhalation, then you hold. The reason why you do this is when you have lower respiratory rates or breathing per minute, you can extend your lifespan because breathing itself causes free radicals. This is why if you look at animals that pant, they have short lifespan. And this is the reason why yoga practitioners live long and healthy, simply by controlling the breath. So what actually happens when you take your inhalation, say, but the proportion to inhalation and exhalation is 1:2. So example, you breathe in for 4 seconds. You hold for 2 seconds. That's hold, which is half. Okay? But you must breathe out for twice as long as the time you have taken to breathe in. So if you took 4 seconds, if you breathe in for 4 seconds, you must breathe out for 8 seconds. Then you hold for 2 seconds. Then you breathe in again for 4 seconds, hold 2 seconds, out 8 seconds, hold 2 seconds. Now, if you do this, it has been proven scientifically to improve mitochondrial function. I posed this question to Schellenberger, who actually gave us a brilliant lecture on mitochondrial health. Asked him, does it help to improve mitochondrial function because there's less oxygen consumption and less free radical damage? And he said, yes, he himself has done some experiments and noticed that slow breathing improves mitochondrial function, and that is very important for health and longevity. That's a tip. Okay. Thank you. Good night and namaskar.